Hello and good evening, everybody. I'm Bill McGinty here at WCNC TV, and this is WCNC.com. Basically, we're producing up a live town hall. We know that all of you have a lot of questions about going back to school and about mask mandates, depending on what state you live in. And so we're joined tonight with two doctors here from the Charlotte area, and we're going to do our best to answer all your questions. So please submit them. Anything and everything you have about COVID, about masking, about vaccines, anything we think we can answer, we will certainly do our best to get you an answer. So I'd like to bring the doctors into the conversation to talk a little bit more, first of all, about themselves and their qualifications, who they are, where they work. Doctors, take it away.
Great. I'll start first. My name is Dr. Betsey Tilson, and I serve North Carolina as the State Health Director and the Chief Medical Officer for the North Carolina Department of Health and Human Services. I'm a pediatrician by training, practiced primary care pediatrics for 26 years, and also public health and preventive medicine trained. So I'm really excited to be with you all tonight and really excited to answer questions. I know that parents and families have all sorts of questions, and we may not have all the answers, but we will happily answer as best we can your questions.
Thank you, Dr. Tilson. I'm Dr. Catherine Ohmstede, and I am a general pediatrician in Charlotte, North Carolina, practicing here for the past 15 years. And I am also the physician leader for the Children's Institute of Novant Health. And I appreciate the time and look forward to answering your questions as best we can.
All right, great. I already see that we have a question. It says, are masks going to be required in the Towson Salisbury schools? From Joy. Joy's asking that question. And I think I could probably answer that right off the top of my head by saying that it depends on what district you're in as to whether or not there is going to be any type of a mandate as to whether or not you're going to be wearing a mask in schools. As I understand it, masks are voluntary if parents want to send their child wearing a mask. And Dr. Tilson, correct me if I'm wrong, but that seems to be the case. If parents feel more comfortable having their children mask up, then that's the case. But there doesn't seem to be a mandate unless an individual school district requires otherwise, correct?
So there is not a statewide mask mandate. That is correct. And so the decision about masking, whether or not it's required or optional, is at that district level. So it really is for parents that are listening, reaching out to their school board to understand what the decision of that specific school district will be. There may well be requirements versus optional, but it's at the school level that decide that.
You know, I see another one here. Is it okay for my child to take Lysol to spray their area? You know what? My wife is a teacher, so I can tell you that I know. I can't speak for every teacher, but I can tell you that I know most teachers wipe down the classrooms, and they're certainly being cleaned by custodial staff. But I think sending little things of hand sanitizer. I know a lot of parents do that. I know my wife, if we had elementary school age kids through this, would be doing the very same thing. So I guess you have to take the necessary and appropriate action based on whatever you want your child to do, and certainly consider the age of the child. I don't think a lot of teachers would want aerosol cans and Lysols being sprayed, certainly in the elementary level of their area. But I know that, and I can speak for my wife's school, that things are being cleaned daily and disinfected, and the teachers go above and beyond to make sure that their classrooms are safe environments for the kids. I'm trying to look to see, are we going to school? Yes, I see a lot of questions here. Let me take a question that we got here, actually. What are your suggestions for keeping kids safe during school lunches? Doctors, I'm just going to let either one of you, whoever feels more comfortable answering that question. I know social distancing will probably come into the conversation, but given class sizes and only limited space, it's hard to social distance. And I think any teachers watching this will probably understand that if you have 15 kids versus 30 kids in a classroom, maybe in middle school, I know the class sizes are much bigger. So it's hard to social distance. So do you have any tips, maybe some suggestions to put parents' mind at ease?
Sure. Well, we do know that when children take off their masks, that is when they spread COVID in schools. We've had fantastic data from tens of thousands of children that spread is very, very minimal when their masks are on, but of course masks have to come off for lunch and there's no way around that. So I would encourage teachers as much as possible, if eating outside is an option, if the weather is nice, that's going to be your safest place. Throughout the pandemic, we've seen lower cases of spread in outdoor situations than indoor situations. So that is going to be your best option. If the children need to eat inside, spacing them at least 3 feet apart, but 6 feet if that's possible, is a great way to social distance and decrease spread. Encouraging children to clean their hands before and after eating and keep their masks on as soon as they are finished eating will help us reduce spread as well. It's going to be extremely important for children who have any sick symptoms to stay home so that the ones that we know might be spreading virus won't be eating lunch with the other children as well.
Dr. Tilson.
Yeah, that's exactly right, everything that Dr. Ohmstede said. The other thing I would add, though, if you're inside, absolutely outside is better than inside, but if you're inside also, if it's possible to open the windows, as long as that is safe and increase air circulation, that helps as well, that increased ventilation if you're in an indoor setting.
So do you see a bigger risk? I see a question here from Christina asking about high schoolers. She's concerned about high schoolers returning. So do you see a bigger risk for COVID transmission amongst high schools versus elementary schools?
Well, fortunately, high schoolers have access to the vaccine, which is absolutely our best way to protect our children. And so high schoolers should actually be at the lowest risk because of the availability of the COVID vaccine to all children 12 and up.
So when we talk about transmission, and COVID spread, certainly amongst the kids in the population that cannot be vaccinated, are they more likely to be asymptomatic, or are they more likely to not show symptoms maybe that an adult would? So, that would be concerning, I guess, for a parent of an unvaccinated child bringing COVID, home into the home.
That's right. There's several things in there. What we know is that children in general have a lower risk of having a severe disease, which is good. And that's not the case with a lot of our respiratory viruses with our young children. So that is a good thing with COVID. But yes, it is true that children can get infected and then they can spread it. And you're right, they don't live their life at school, so they also could go home and they might be around some adults that are at higher risk or people with immunocompromised, which is one of the reasons why, again, just like Dr. Ohmstede said, that if they're able to get a vaccine, that's the best strategy. But for those 11 and under, then wearing that mask really decreases that risk of spread amongst children. So it reduces the children getting infected and also then reduce the risk of the child then bringing it home, maybe to a grandparent or a family member that might be at higher risk for complications.
What do you see as probably the biggest hurdle, doctors, and either one of you can answer this, about going back to school with this Delta variant surging like it is? I think we ended last year on such a high note, thinking that maybe the worst was behind us, and then this Delta variant just creeped into our lives and got worse throughout the summer. And I don't think anybody really expected the framework of this current school year to be what it is. What do you really say to parents to put their mind at ease?
Well, the biggest risk I see is that Delta variant is 2 to 3 times more contagious than the variants that we've seen before. And pediatric diagnoses are rising faster than we've seen at prior times in the pandemic. So we definitely need to take this very seriously. My reassurance to parents is we have extraordinary data of tens of thousands of children who went back to school in universally masked schools last year with very minimal spread through the classrooms. So parents should feel very, very comfortable that as long as everybody in the classroom is masked, the risk of transmission is extremely low and the children can go to school and be very, very safe.
That's right. And we're starting the school year in a very different place than we did last year, where we didn't really know, we were learning. We've had the benefit of a whole year of really understanding that risk of spread in school. And just as Dr. Ohmstede said, what we've learned is in school setting with layered prevention strategies. So that means vaccinating everybody who can get vaccinated, wearing masks, doing good hand washing, doing good cleaning, doing good ventilation. And then in many of our schools, we're offering also free screening tests. When you layer those prevention strategies, even with widespread circulation of the virus in the community, you can really keep viral transmission very low. And so we've learned a lot this past school year, and I think we can get our kids in school and keep that risk low with those layered prevention strategies.
So when it comes to masking, this is my little prop. Is this okay? Does this work? I mean, if kids are wearing these, would you suggest, with Delta being so highly transmissible, would you suggest double masking these, or is there maybe just a better fit?
The mask that your child will keep on their face is the best mask for your child. And so we want to have a mask that's not sliding around, that's not requiring the child to readjust frequently, a mask that doesn't have as much gap around the edge, so there's not as much airflow from outside that we won't want to have big gaps. But if the child feels comfortable in the mask and they'll keep it on, that's the best mask for the child. There are many, many different types of masks, and hopefully by now most people have experimented with them, but I don't see a need to go out and buy a different type of mask if your child is comfortable and the mask is well-fitting.
All right, Lisa Crowder just popped in with a question. How are we testing for the Delta variant? Is each person tested to determine the particular variant? That's a good question, because I was vaccinated in April. I had Johnson & Johnson, but then I picked up COVID in June, and people kept asking me, do you have the Delta variant? Did you have the Delta variant? And I said, I didn't know. I don't know how that's determined. And I think that there are a lot of questions surrounding that. Do you have the Delta variant or do you have regular COVID? Is there any way to figure that out for just anybody?
Yeah, not so much on an individual level. What we do is we work closely with the CDC, and we do samples of some of our positive tests. Not all labs have the ability to do the sequencing to know exactly which variant you have. So we do some sequencing at the state lab. We have several private labs, as well as several universities that are able to sequence it. So we get a pretty good sample of what's coming out of North Carolina. And what we're seeing nationally, as well as North Carolina, that 97% of the tests that we're sequencing are Delta. So if you get COVID now, you pretty much know you have Delta. So that's how we look at it statewide.
And are the symptoms pretty much the same as they were with COVID? When I got it, the first thing I noticed as an adult was extreme fatigue. And I mean off the chain fatigue. And then it morphed into very flu-like symptoms within the next couple of days, some body aches. I never had a fever. I had a little bit of a cough, but the fatigue was the one thing that was consistent. So when it comes to Delta, given what you just said, what would you tell parents to be on the lookout for, and maybe even teachers?
Yeah,
What we're seeing, go ahead, Dr. Tilson.
No, please go.
What we're seeing in children is a full spectrum. So over the past week, I've seen children come in with no symptoms. I've seen them come in with a little sniffle. Others have come in with a scratchy throat, a little mild cough, all the way up to in older teenagers who haven't received the vaccine. We've seen difficulty breathing, difficulty keeping their oxygen levels up. So it really can run the spectrum. And I would say the majority of the patients that I've seen in the past 2 weeks have presented with a common cold.
I see a question here from Christina. What do you do if somebody has an autoimmune disease and has been vaccinated, but friends are not vaccinated and are in the same classroom with them? Would that present any sort of a higher risk?
So certainly we want to, what we call, cocoon our vulnerable people, right? So again, we know everybody 11 and under are not vaccinated. So we want to have as many adolescents and adults around those children vaccinated. Same way with people with an immunocompromised or autoimmune disease. You want to have as many people vaccinated around that vulnerable person. And then also, again, that's the importance of everybody wearing a mask as well to prevent that spread as well. So you can have this double layer of protection around our vulnerable folks between vaccine and then that mask wearing.
Does good old run-of-the-mill hand sanitizer, is that good enough?
So soap and water for at least 20 seconds still rules, but hand sanitizer is pretty good as well as a second.
Kids are notorious, for, how do I say this? touching their noses, touching their mouths, touching their eyes, not washing their hands as well as they should. If you're talking to parents right now, maybe what would you suggest to them to, drill into the kids? Hand washing is more important now than it ever was. And I know we're 18 months into COVID, so most every kid should know that by now, but would you suggest continuing to just drill that down?
Absolutely. And you're right. Children who were in school last year, even for part of the year, definitely are aware of hand washing protocols. And as I'm sure your wife would attest, teachers have done such an extraordinary job keeping the classrooms clean and safe. So I would definitely have that hand sanitizer in the backpack and send them to school, and continue to remind your children also to wash their hands when they come home from school and before they leave for the day.
How often would you suggest, because the symptoms of the Delta really can mimic either the common cold or just fluish, is it just go get a test if you feel uncomfortable or if you see something you don't like? And your child, certainly if your child isn't vaccinated, I guess we're talking about younger kids here. Is that what you would suggest? And then what's the protocol beyond that? Let's say the test is positive.
So if a child has a positive test, they need to isolate for 10 days. And the quarantine of the classroom depends on if everybody in the class is masked or not. So, and Dr. Tilson can confirm, but the new North Carolina Safe Schools toolkit it tells us that if everybody in the class is vaccinated or masked, those children don't necessarily have to go home for 14 days. But if the person who is spreading the virus or the other children in the class were not masked, then they will have to go home. We do absolutely recommend that anybody who has symptoms stay home and not spread viruses, because it's a very huge interrupter to family life for children to come home with a fever, a runny nose, cough. Now they need to be tested for COVID too. And so keeping your children home until they are well will be really important for us all getting through the school year with as consistent education as possible.
What do you all see as maybe just the biggest hurdle for going back to school? I know a lot of people are concerned there's no virtual option. I'm seeing that in some of the questions here. Do you think in-person learning is, I hope I'm not putting you on the spot with this, with your opinion, because I know, medicine is very fact-based, but do you think there should be a virtual option, or do you think in-person learning is okay and safe?
For the majority of students, they need to be in person. The isolation that children saw last year was harder on children than on anyone else. So for the majority of healthy children, I would encourage anybody 12 and up to get vaccinated so they're safe. As soon as the vaccine is available for 5 to 11-year-olds, be first in line to get your child safe and protected and get them in school and keep them in school. For those who are at high risk, and that's a good discussion to have with your pediatrician, there are definitely students who thrive in a virtual setting, especially if there's significant anxiety about being in person. And so we're very fortunate to live in a state that has a complete virtual option for those students as well.
We often hear the term misinformation, and misinformation can be a very gray term in that one person's misinformation is another person's fact, at least in their own minds. So where can people go to get the facts? Where would you suggest they go to look?
We have on our DHHS website, on our COVID DHS website, we have lots of FAQs, facts, information for families, for providers. I would absolutely go to our website and to the CDC website for factual information. On social media, there is a lot of misinformation out there, but on our website and CDC website is where you can get that factual information, as well as going to your pediatrician, going to your doctors as well, those trusted healthcare voices.
A lot of people are confused by the fact that we've got these vaccines out there, but there are these breakthrough cases. I was shocked when the test came back positive, because I thought, well, how could this be? I'm vaccinated. Can you maybe put that myth to rest that just because you're vaccinated doesn't mean you're invincible?
Yeah, let's talk about the post-vaccination infections, what we call them. So from the beginning, we've known that these vaccines aren't 100%. Now, they're incredibly effective, better vaccines than we've seen in a long time, incredibly effective, but never 100%. So we know that we always expected we'd be getting some infections after vaccination. But the really good news is that even if you were to have an infection after a vaccination, your risk of severe illness, hospitalization, death goes way, way down. So that is really, really, really good. So yes, we've always expected there will be some cases after vaccination, but we still are seeing very high levels of protection. And again, the severity of the illness, if you were to get the infection, after the vaccination goes way down.
When it comes to vaccine safety, what would you say to somebody, and maybe some of these people are here in the watching this, that I just don't believe this vaccine is safe. How would you, as a medical professional and a medical doctor, put those fears to rest? What would you tell them?
We have more data on these vaccines than on so many other medications we use. We've given over 4 billion doses of COVID vaccine worldwide, over 300 million doses of the mRNA vaccines that we're giving to children. So we are very well aware of what the effects of those vaccines are. And what we've seen throughout the 200 years of vaccine history is that when vaccines have unwanted effects, those effects are pretty immediate. We see them within 6 weeks of giving the vaccine. And since we now have several months of data on children, we are very comfortable knowing that these vaccines are very, very safe in children. And the effects that we do have are much, much safer than the effects that we see from COVID.
You know, when it comes to antibodies, I hear a lot about this. A lot of people are curious that once you've had COVID, you've got antibodies. And I've heard from a number of people that say, oh, I don't have to worry about the vaccine because I had COVID and I've got antibodies now. How long do the antibodies last? Does it depend on the viral load that you had as to how many and how much antibodies? I'm not sure the proper vernacular there to be using, but can you talk a little bit about that?
Yeah, I'm happy to. So a couple things that we are learning about people with a natural infection. So what we have found is that about 3 months after your natural infection, it does look like you have very strong protection and it's very unlikely to get reinfected within 90 days of that original infection. We're still learning, though, how long that immunity will last from that natural infection. And we are seeing people who are also getting reinfected after a natural infection. So the 90 days beyond, we're still learning about how long that natural immunity is. Another piece is that we're still understanding how the immune system works with the natural infection and the vaccine, and how much that circulating antibody that you can detect versus another type of antibody that rests in your cell that might be the more protective one. So we're still learning about what the implication of measuring circulating antibody is in terms of natural infection. The other thing that we are learning, though, is if you've had the natural infection and then you get the vaccine, it is stimulating different parts of your immune system, and you have a very robust, very strong response and protection from that combination. So just because you've had the vaccine, just you had a natural infection, we are still encouraging you to get the vaccine and really strong protection from that. And then there was just a study that came out from Kentucky that showed people that had the natural infection were about 4 times as likely to get reinfected than people who had the vaccine. So still get the vaccine if you've had that natural infection, and it helps your body protect you in 2 different ways.
There's a lot of conversation out there about booster shots. And I know there's no, we're so new to this still. What's your personal thought? And I hope I'm not trying to pin you down on something. What's your personal thought on a booster shot, and how long after the original? Use me as an example. I had my vaccination back in April, and then I had COVID in June. So would I need use me as an example? Would I need a booster shot maybe next year sometime?
So what we're seeing in our area and across the country is that 95% of people sick enough to be hospitalized are unvaccinated, and 99+% of people dying of COVID right now are unvaccinated. And the average age in the Charlotte area of the vaccinated hospitalized patient is 77. And so at this point, it looks like young, healthy people who are vaccinated are still very protected from severe infection requiring hospitalization and death. That doesn't mean you won't have a runny nose or a cold or a headache or feel worn out for a week, though we certainly understand that there can be some discomfort from having a COVID infection after vaccine. But what we want to do is prevent hospitalizations and deaths, and that's being watched very, very carefully in our hospitals and across the country. There's lots of talk about getting boosters, and it was in the paper today. I'm sure many people read that next month there very likely will be boosters for those who are vaccinated first, with the thought that there may be some waning immunity by the time you're 8 months after a vaccine. Certainly anybody who is immunosuppressed, has had an organ transplant or a severe immunosuppressive illness should talk to their doctor about getting that booster now.
So I'm looking at one of the comments here. It says masks are useless. Anybody inside of a school watches kids pulling and tugging while touching everything in the school. I can't help but dwell on the line, masks are useless. Both of you feel completely otherwise, correct?
That is what we've seen from the data internationally, nationally, and in North Carolina. And nothing is perfect, and you're right. Sometimes, and Dr. Ohmstede was saying that the best mask is the mask that the child is comfortable in. But we've really seen that data across the year, that those schools that have layered prevention, including masking, have really a low rate of transmission.
And so I know, and I don't want to repeat things, but I know that there some have joined, and maybe after the fact we covered this, but just going back to parents who are nervous sending their children to school, do you have any advice to put their, calm them a little bit?
I think the best thing we can tell parents is that most of our hospitalizations are still in children 12 and up who are old enough to be vaccinated. And those hospitalizations are in unvaccinated children. So if your child is 12 and up, they must be vaccinated. There's no question about that. Children who are younger than 12 are much less likely to have a severe outcome. And they can be protected by masking, hand washing, social distancing, outside play, all those things that we've talked about all this time. Children did a very good job last year wearing their masks in school. I'm amazed in my pediatric practices how well a 2-year-old keeps on a mask. I think they do a lot better than adults. It's sort of like a bike helmet or a seatbelt. They've grown up doing that, and it makes it very easy for them. And by the time they get to kindergarten, it's pretty easy. So if we continue the measures that we proved worked last year, schools should be a safe place for children.
Yeah, we keep hearing a lot about these variants. First we had COVID, and then we had the Delta variant, and now I'm hearing the word Lambda variant. I just wonder maybe if you could explain, how does a virus mutate like this, and when it does that, how does it affect the population?
Yeah, so this is what viruses do. They're brilliant. Viruses, what they do is they transmit from person to person, and then they have these genetic mutations all the time. This is what they do. And what often happens is those mutations that allow them to be more contagious are the ones that spread, because it's more easily spread, therefore they can get more traction. And so that's what we're seeing. Now, the really good news right now is that with the Delta variant, our vaccines are still very protective against the Delta variant, and that is a really good thing. My fear is that this virus continues to spread and mutates into a version that the vaccines are no longer protective and effective against. And that really worries me, because we will lose what's an incredibly important tool in our toolbox. So that viruses do this all the time. They vary. That's what they do. Right now, we have a critical window that this virus is still that these vaccines are still very protective against this variant. So getting vaccines now, huge urgency, and not letting this virus run wild and then morph into a version that the vaccines are not protective against.
Are the vaccine makers looking at this thinking, okay, well, this is what we have now, but it may be this later on? If we have to get a booster, will it likely be different than the one we got originally? To include.
The great thing about mRNA technology is it can be tailored to the virus as it changes. As you all know, we have a new flu vaccine every single year that we produce many, many months in advance. And sometimes it works great, and sometimes we misjudge because there's so many months of lag time to get that new vaccine out. With the mRNA vaccines, we should be able to produce boosters much more quickly. And so our hope is that we will be able to keep up with the variants if we can get the virus under control now.
With so much talk and conversation about vaccines, so we've got, and you mentioned the flu shot. So would you recommend if you get a flu shot, if you got a COVID vaccine, you still get a flu shot, and then for anyone older who might be watching, I know that there's a pneumonia shot out there, and then you have the shingles vaccine. So what do you tell those people who are just kind of leery about, wow, I'm putting a lot of vaccines in my body?
We have so much history with vaccines in this country, and it is one of the biggest achievements in public health. So vaccines are incredibly protective, incredible amount of data and research and studies that go into these vaccines. And the risk of these diseases are much greater than any theoretical risk of the vaccine. And yes, getting a COVID and a flu vaccine, especially this year, incredibly important.
So I'm guessing, just based on some of the comments, that we have some teachers that might be watching this. So what advice would you give to them in handling their classroom? Whether it be advice on how to clean, how to social distance. I know they went through this last year, and so they're pretty squared away on how to do this. But is there anything additionally that you would recommend to them?
Well, first off, I want to thank all of the teachers who went through COVID last year and showed up and figured out how to teach our children online and got them back into the classroom. That is such a heroic act, and I'm so grateful. Going into this year, I know teachers are exhausted like healthcare workers are. We're all tired of the pandemic. We all were hoping that we would be done with it by now, and never expected it to be worse than it ever has been the week we are about to go back to school. So my advice for teachers would be the layered approach, the Swiss cheese approach, like Dr. Tilson was saying. Everything we do helps some. So masking helps. The teachers, fortunately, 90% of our educators in this country are vaccinated, thank goodness. So they're protecting themselves by vaccinating. They clean the rooms like we were talking before, open the windows as much as possible on beautiful days to increase the ventilation, wipe down the rooms at the beginning and the end of the day and after meals. And as much as they can get the children outside, if there's a way they can incorporate their lesson into outside play, the more fresh air, the better.
Yeah, I see one of the comments from Nikisha saying, thanks to all the teachers and staff for all that they're doing. People don't realize what happens behind the scenes. There's so much that goes into making sure that it's a safe and loving environment, at the same time educational. So yeah, teachers and all the administrators and down to the lunchroom staff and the custodial staff for keeping the schools clean. Definitely, it's a big thumbs up, because they've done a very heroic, I think, and Herculean task was the word one of you used earlier. Medically speaking, doctors, is there anything I haven't touched on so far that I should be asking you that I'm not?
I think one question I get a lot is, if I am a parent who's concerned about my child's safety and my school doesn't require masking, what should I do? Should I send my child in a mask? Should I not send my child in a mask? We all know that the most important thing to stop spread is that the child who is spreading the virus wears a mask. But even if you're the child who's not spreading the virus, it helps some. And so I would definitely encourage parents to send your child in a mask, even if you're in a mask optional school. It will help some to prevent COVID in your child, but also maybe equally important is that it will protect your child against flu, against RSV, against all the other viruses that we see circulate. And right now, getting a cold or getting a fever is extremely disruptive to family life. Children are sent home. We've seen this through daycares all through the summer, and it's so hard on families. They're sent home and they have to get COVID tested and they have to wait till symptoms improve to get back to school. And so if you can keep your child healthy by getting a flu shot, sending them with a mask, even if everybody else isn't masking, it is still in your child's best interest to do so.
And the other thing I would add to it is also talk to your school leaders, talk to your boards of education, talk to your school leaders, and make sure they hear your voice as well of what you want. So use that power of advocacy and that voice and speak to the decision makers at your school system.
So what would you tell the parents? A lot of parents both are working, some are back in the office now. Now it's great that we all have remote options now. Taking a day and working from home is a lot easier now than it ever has been. But if a parent wants to send their child to school and they think, oh, you know what, they just picked up a cold. Where's the fine line between a cold and COVID? Considering that they're in the same family and this Delta variant, a lot of the symptoms mimic a cold anyway. Is it run out and get a test all the time? Or are these at-home tests, are they any good?
So you're right. In Charlotte, in this past week, we've seen 16 to 17% of tests in children with symptoms come back positive. And we've actually seen 10 to 12% of tests coming back in asymptomatic children are coming back positive. And so, yes, if your child is sick, they should go get tested and stay home until symptoms are improving. There are at-home tests, which can be a great screen. They're not quite as sensitive as the tests in the doctor's offices. If you were going over to visit family and maybe you're going to have a family dinner or something, I think doing a home antigen test could be a really good idea. If you're not in a situation where you've been exposed, you're not sick, you feel like your risk of COVID is very low, but you want to do your part to reduce spread, I think that home kits can be a really helpful tool.
Okay, well, certainly a lot of good information here, doctors. I'm gonna give you guys the last word. Give you ladies the last word. If there's anything else you want to touch upon that we haven't touched upon so far before we wrap things up, Dr. Tilson, I'll start with you.
Thanks. I think we touched on really some of the main points, and this idea of layered prevention, right? Not one particular thing is perfect, and so layering as many of these prevention strategies together is the way that we can lower the risk as much as possible, because in-person learning is critical for our children, and we want our children and our schools to be successful. And what we've learned is we can have successful in-person learning when we layer all these prevention strategies together.
I agree, Dr. Tilson. Absolutely. I would add to that, encourage any family with a child 12 and up to get vaccinated as soon as they possibly can. As the vaccine becomes available to younger children, seek that out as soon as you possibly can. The best chance we have to get rid of our masks and get out of this mess is to vaccinate as many of us as we possibly can.
Well, Dr. Tilson and Dr. Ohmstede, I appreciate you taking the time out of your night to do this, because the only way people are going to feel more comfortable about the process is if they hear from experts like you in terms of sending their kids back to school, because mine are older. One's out of college and the other is still in college. And so not that the fear and the worry isn't there, but when you have smaller kids that are unvaccinated and you have maybe an elderly grandparent at home, living in the same house, there's a lot goes into, a lot more moving cogs. So I appreciate you being here to lay out some of the facts and some of the questions. And thank you to everybody who submitted questions. We certainly appreciate it. And if you all have any questions, don't forget, we have a vaccine guide here at WCNC. Shoot us an email. We'll get that right out to you. We're always doing these verify stories where we verify our sources to put out the most, the correct information, because we go right to the sources. Because I think one of the things that is the biggest problem with this whole COVID thing is the misinformation that is out there. So thank you both for taking time out of your night to come here and just lay out the facts and answer questions. We appreciate it.
Thank you so much.